Welcome to Sketchy. We take all the super complex stuff you need to learn and turn them into memorable visual stories packed full of everything you need to know on test day. Click the link in the corner or description to try for free for 7 days. Now let's get to it. All right, let's take a break from the seriousness of heart failure for a hot minute and hit the country music festival. It's about time we caught some tunes. In this sketch, we'll talk about what happens when the lining of the heart, known as the pericardium, gets inflamed. In part 2 of this series, we'll talk about some of the other diseases that can affect the pericardium, and finish up with inflammation of the heart tissue itself, known as myocarditis. Okay, that's enough. Thank you. But first, as always, let's begin with some definitions. See that guitar case? That's a recurring sketchy symbol for the pericardium, a fibroelastic sac surrounding the heart. Similar to the pleura surrounding the lungs, the pericardium is composed of a parietal and visceral layer. The space between these two layers, known as the pericardial space, normally contains a very small amount of fluid. Pericardial disease can present clinically in several ways. The most common of them all is acute pericarditis, which refers to the inflammation of the pericardial sac. At Sketchy, if a guitar case represents the pericardium, then pericarditis must be a flaming guitar case. A pericardial effusion, which doesn't always occur in conjunction with acute pericarditis, is present when fluid accumulating within the pericardial space exceeds the small amount that's normally present. If pericardial fluid builds up, eventually the pressure within the pericardial space begins to increase. Cardiac tamponade occurs when the intrapericardial pressure becomes so high that cardiac function is impaired. That said, fluid accumulation isn't the only process that can compress the heart. A number of diseases can result in scarring and subsequent loss of elasticity of the pericardial sac, a condition known as constrictive pericarditis. This sketch will be dedicated to acute pericarditis. To learn more about pericardial effusion, cardiac tamponade, and constrictive pericarditis, check out part 2 of this series. For now, let's dive into the clinical presentation of acute pericarditis. The most common symptom of acute pericarditis is sharp pleuritic chest pain, represented by our recurring sketchy symbol, the shark tooth necklace. The pain is classically improved by sitting up and leaning forward. Yep, just like this guitarist. Look how happy he is. Patients with an infectious etiology may present with signs and symptoms of systemic infection, like a fever, represented by our recurring sketchy symbol, the flame headband. Viral etiologies in particular may be preceded by a flu-like illness, represented by those used tissues lying around on stage. If the first few minutes of your history taking have you concerned for pericardial disease, your next few questions should be directed towards figuring out the underlying etiology.